welcome you to the Senator's live telephone town hall conversation. For those of you who are wondering if you're connected, you are, and we'll be taking your questions live momentarily. In just a moment, I'll introduce Senator Luján, and then we'll open it up for questions. If you would like to ask a question, press *3. Again, if you'd like to ask a question, press *3. After you press *3, you'll be put in line to speak with one of our staff members. They'll hop on, take down your name, where you are across New Mexico, and your question, and then we'll try to get to you as quickly as possible. The next time you hear your name, you'll be live to the entire telephone town hall and can ask your question directly to Senator Luján. Again, press *3 to ask Senator Luján a question. We'll do our best to get to as many questions as possible this evening, so please press *3 now if you'd like to ask a question to Senator Ben-Ray Luján. Again, that's *3 to ask a question. And now I'd like to turn the conversation over to Senator Ben-Ray Luján. Senator?
Carney, thank you so very much. And everyone across New Mexico that's on the call already, thank you for taking the call tonight and for being available. Good evening to you all. As Carney said, this is Ben-Ray Luján, one of New Mexico's United States Senators. And just simply want to start by saying thank you for joining me tonight to talk about all that's going on. We've been getting a lot of phone calls to the office and emails and letters. And I want to say thank you to everyone from New Mexico that's been reaching out to me through our offices back in our state or straight to the office in Washington, D.C. As you all know, we are now in day, 21 of a government shutdown. It's been more than 30 days since my House Republican colleagues actually have been in Washington, D.C. Speaker Johnson, the Republican Speaker of the House, he told everyone back on, I think it was September 20th, to go home, and they've not been called back. They're not here voting. So that's been one big challenge to everything right now. And to put it plain and simple, this shutdown didn't have to happen. As I remind a lot of my colleagues and journalists that visit with me here in D.C. or in New Mexico or constituents when we get a chance to visit on the phone, just to remind them who's in charge right now. Republicans have a majority in the United States House of Representatives. Republicans have a majority in the United States Senate. And as we all know, Republicans control the White House. Now, under Republican leadership, that's where this all started, which led us in the United States of America into another government shutdown. And, just a reminder, over the previous administration under a Democratic president, President Biden, when there were Democrats in the majority in both the House and the Senate, as you all remember, there was not a shutdown during those previous 4 years. But that doesn't help us with where we are today. So, just wanted to share that with you. Now, instead of working to keep the government open and protect the affordable health care for millions of folks across America and across New Mexico by making sure that these tax credits for preventing health insurance premiums from more than doubling for so many folks across home and across America, my Republican colleagues they're saying that they're not going to have a conversation right now, as you all know. Now, Americans, now that includes Republicans and Democrats and independents, they overwhelmingly support extending tax credits to help make health care more affordable. And this is what I've been hearing from people when I've been in New Mexico, whether it's at a grocery store or at church services or, wherever it is we get a chance to see each other. Now, what I've been clear about is that it's time to stop premiums from doubling, plain and simple. Now, this will prevent millions from possibly losing health coverage as well. I would argue that it will help keep more rural facilities open as well that provide care and protect access to care for families. Now, again, let me be clear. The shutdown was a choice by our Republican colleagues in Washington, D.C., and it's a choice right now that's hurting workers, veterans, seniors, families who are already struggling with high costs. And you all know it. Every one of you that's been to the grocery store lately, and you've seen those high prices. Even if you're stopping to get a cup of coffee on the way to work, you're seeing what that cup of coffee is costing you now as well. And so, look, to sum this thing up, instead of focusing on lowering healthcare costs, getting these tax credits extended so that way there's more money not being taken from the American people, my Republican colleagues are simply choosing to play politics with people's livelihoods. Now, it's a choice that the president's even making to start firing hardworking Americans. All this conversation about RIFs and using acronyms that the president's been using to fire people, that's a choice of his. These rifts have never been put in place during a shutdown where they start firing people the way that he's planned this. It's simply unacceptable. And just to be clear with everyone on the phone right now and people across New Mexico, I'll continue fighting to reopen the government. I'll keep fighting to pay every federal worker and contractor what they're owed and make sure families don't suffer because of Washington dysfunction. Just last week, some of you may have read that I introduced a piece of legislation with my colleague from New Mexico, Senator Heinrich, to ensure that federal contract workers also hurt by this shutdown receive back pay because they're just like federal employees, but they're not currently included in some of these protections. These are hardworking men and women who deserve the same respect and compensation as everyone else, doing their part to serve the public and in many cases our national security. I'm also proud to stand alongside my colleagues who are fighting to make sure these hardworking New Mexicans are not left behind. A colleague of ours from Minnesota, Tina Smith, also has another piece of legislation that will make sure that federal contractors are going to be treated the same as federal employees as well, with making sure that they're able to be made whole. So look, as we get to questions here, it's far past time that President Trump, who in his own words, you may remember this, you may have seen the president speaking himself, said the president bears the responsibility to bring people together to prevent a government shutdown. I think we're all expecting just that. Now, as you know, with all that's going on right now, if you or someone you know that has been impacted by this shutdown, please reach out to me in my office. We'll do everything we can to provide support. Now, if you have access to the internet, you can find me online at luján.senate.gov, and I'll make sure I share the number to the New Mexico office and the DC office with you here in just a little bit. But if you have access to the internet, you can find us over at luján.senate.gov, and there's a lot of information that we already have in that space as well. So, Carney, I'll go back to you. I look forward to the conversation, everyone. Thanks again for your time tonight. I know you're busy. Some of you just getting home from work as well. It's still in that early hour, but we wanted to be thoughtful, so we were not interrupting dinner tonight back in New Mexico for you all. We wanted to make sure we're getting a chance to visit. So thanks again, and Carney, I'll turn it back over to you.
Well, thank you, Senator. For those folks just connecting to our live telephone town hall conversation with Senator Ben Ray Luján, if you'd like to ask the Senator a question, it's very easy. Press *3. Again, press *3 to ask Senator Luján a question. One more time, that's *3 to ask a question. Senator, we're also streaming this live on social media. So our first question comes from Chad in Santa Fe. And Chad's question, Senator, is, with healthcare at the center of conversations right now in Washington, why is it so important to address the ACA tax credits right now?
Well, Chad, plain and simple, there's a concern right now from people all across New Mexico that what happens if these tax credits go away? Now, these are tax credits that you all remember were put in place to make healthcare a little more affordable for folks. For people across New Mexico, this equates to about $7,000 a year. That's $7,000 that people just don't have in their pocket right now to help be able to make healthcare more affordable. And look, many of you know I survived a stroke 3 years ago. And I know that time is not on your side when you need to go see a doctor, or these emergencies just sometimes pop up. Now, what happens if we get back to a place where people just don't have access to health insurance? Now, this is on the back of my House Republican colleagues eliminating almost $1 trillion. I mean, it's hard to even equate how much money that is, but essentially taking away all the federal money to Medicaid. That's going to make it harder for people all across the country, including in New Mexico, to make Medicaid more available to folks. And you'll remember it was under a previous governor in New Mexico who was a Republican that there was an effort to expand coverage to people in New Mexico to get Medicaid. Now, that's a separate issue, but it's all connected when we talk about health care. We're talking about these tax credits right now. Now, open enrollment begins in just a few days, as every one of you knows that is waiting for that November 1st date to sign up for care as well. And families need certainty about what they're going to pay for coverage. Without action, millions of people across America could see their premiums skyrocket, and in some cases more than double, when the Affordable Care Act tax credits would expire. Now, this comes at a time when everything is already more expensive. I shared that with you all, and some of you may have even seen some of these articles across the country. U.S. consumers bearing more than half the cost of tariffs so far. In a market for a new car, prepare for sticker shock. Grocery prices keep rising. Frustrating consumers are trying to figure this out, trying to adapt. Beef prices hit record highs. Nationwide cattle inventory drops to the lowest level in 70 years. Now, it might surprise you. I mean, I'm reading some of these headlines from like Fox News and from the Wall Street Journal, from other outlets as well. I mean, this is what we're seeing across the country and across New Mexico. And so, look, here's one of the last concerns that I'll share with you in this space as well, is that under President Trump, it's not just premiums that are rising. I just talked to you about all of these other costs that are hitting you, and those of you that are currently taking prescription medications, you're seeing what's happening right now to the cost of those drugs. President Trump promised that he was going to do something real to control these costs. Well, under the Trump administration, Secretary Kennedy, who's over at the Health and Human Services Department, they're all supposed to be keeping an eye on more than 700 drugs right now. These are 700 of the prescription drugs most used by the American people, and they're not doing their job here. They're not controlling these costs. As a matter of fact, it's gotten more and more expensive. So you all know that are paying those hospital bills, and God bless you all, and I hope you're safe and healthy. But those of you that have been having to go see the doctor or been having to go get those prescription drug prices, you see this all happening. That's what this all comes down to. Making sure that healthcare is going to be more affordable, that these tax credits that my Republican colleagues right now are threatening just to take away from the American people, that means it's going to be taking money out of your pockets. It's going to make things more expensive. And don't think that just because you don't currently benefit from one of these tax credits, you're not going to get hit. If these tax credits go away, the marketplace is just going to get more expensive. It's going to make everyone have to pay more, and that's just not right. So very much appreciate this question. Appreciate being able to get a chance to explain that a little bit as well. So thank you so very much.
Thank you, Senator Luján. If you'd like to ask a question this evening, it's very simple. Press star 3. Press star 3 to ask a question. Senator, we've got over 9,000 constituents joining us right now and climbing. So we'll get to our next question from Ricardo in Rio Rancho. Good evening, Ricardo. You're live with Senator Luján.
Hi, Senator. How are you?
Ricardo, I'm doing all right, brother. How are you, man?
You know, I'm just concerned about the state of New Mexico right now. We've got a lot of bad things like fentanyl and, crime and poverty. And I'm just tired of seeing New Mexico at the bottom of the list on everything, education, all those things, all those negative things. When do you think, we could turn this around, and start being at the top of these lists in education and stuff like that? What are we doing? What are you and your colleagues doing in Washington to ensure that the future of New Mexico is somewhere close to the top and not at the bottom of all those lists?
Well, Ricardo, you're absolutely right, brother, to be concerned about home, man. And I appreciate your advocacy and the way you asked that question about wanting to make sure that we in New Mexico have access to the greatest programs that there are across the country and what more can be done. Look, at the top of that list, we need to make sure that as we're fighting for better education in our state, not just with early childhood education, as you might know, I was one of the folks that benefited from Head Start. I'm actually one of 2 United States senators now that went to Head Start. I believe in early childhood education. We need to change the way that we're educating kids and providing support to families in each and every one of those spaces as well. When it comes to being able to find those job opportunities, looking at the job market, as you may have read recently, I mean, even there in Rio Rancho, there was an announcement of a significant investment in the billions of dollars for a new company that's going to create more job opportunities for folks that whether they go to college or they don't go to college, whether they're going to apprenticeships or they're learning about other opportunities, there's job opportunities in each and every one of those spaces. More and more expansion in and around Albuquerque, around Mesa del Sol, as you know, with some recent expansions of opportunities, similar to what we saw down in Valencia County in Belen, where we saw an announcement about expanding more wind turbine opportunities, things of that nature. Down in Santa Teresa and Doña Ana County, we're still seeing opportunity down that way with job opportunities and creation. And one of the areas that I focus a lot on, Ricardo, is looking at our 2 national laboratories as an example, in Los Alamos and Sandia. I believe that there's a lot of opportunity, more opportunity that we have with spin-off, job opportunity, job creation, and looking at expanded internet access across New Mexico. That only provides us more access to healthcare. It keeps us better connected. It lets people expand more opportunities. It provides more tools for kids going to school, stay close to that homework, helps parents as well. Those are all things that I believe in as well. And then Ricardo and healthcare. I mean, I'm really worried about what's happening with healthcare right now. In a state like New Mexico, where a big number of the state, about half the state, right now they're Medicaid beneficiaries. And again, under a Republican governor, there was an effort to expand Medicaid coverage in New Mexico to help make sure people, when they got sick or they may be fighting cancer or some chronic disease, that they could actually get to the doctor. And right now, that's all being threatened. And it's not just how that's going to impact us, making healthcare more expensive if we can even afford it, but with the federal disaster to these Medicaid funds, it jeopardizes rural health clinics. And so, look, I live in Nam Ben now. I love it up that way, and some of us live in communities where there's a few, fewer people than in some of our bigger cities in New Mexico, in the rural parts of our state. Well, all of a sudden, those rural health clinics are under question with being able to be funded. And if those things close, people are going to have to drive hours and hours to be able to get to one of the city hospitals because these rural health clinics are going to close. And then in addition to that, it's also on hunger, like you said. We need to provide more opportunity to support local ranchers and farmers back in New Mexico and be able to enjoy that beautiful food that we know that we love to get whenever we're on the road or we're fortunate to stop at a stand or shop at a local grocery store, whether it's beef or the few lamb producers we have in New Mexico or our apples or whatever it is, nuts, chili, man. We've got to find a way to be able to provide more support to our local agriculture communities. And that's one of the areas that's being hit hard, not just locally, but also federally right now, not just with the inputs with these tariffs, which is making things more expensive. Talk to a farmer or rancher and they'll tell you they can't afford those implements now to plow the fields because the tariffs are making it more expensive. You can't even afford fertilizer, man, to put on your fields because that thing's being hit by this area as well. And so these are all areas that I think we can do better. Job opportunity, educational opportunity, connectivity when it comes to the internet, roads, bridges, wastewater. Water in New Mexico, it's life or death, man, as you know. And whether it's working in a rural community with the acequias, that's something that I support and I believe in and that I push every day to make sure my colleagues are being supportive in those spaces. But those are some things that we've been able to do federally where I've been proud to earn support from Democrats and Republicans, get things signed into law by a Democratic president and even a Republican president. We have to find ways to work together. But like I've always said, Ricardo, I'll close with this, brother. When it comes to working to make things better in New Mexico, my door is open and I'm willing to work with anyone to make things better at home. But if someone here in Washington, D.C. is going to do something that's going to hurt us in New Mexico, then I'm going to stand up and I'm going to fight, man. We're not going to let you just come in and do things that are going to hurt us back home. So I look forward to hearing more from you, learning more from you. You're absolutely correct in creating more opportunities, affordable housing, make sure that someone can buy that first house. If you're not in a position where you can buy the house that you can afford to pay rent, man, because everything's getting more expensive back at home as well. And like I said, if there's an emergency now, something that costs an extra $500 a month or $7,000 a year with what's going on with these tax credits that could expire right now on healthcare, those are all things that worry me that we need to fix to get people the support back home and make sure that they're going to have all the support they need. So again, look forward to maybe getting a chance to meet you down the road, sir. If I'm in Rio Rancho or Pass Cross, I hope to meet you, Ricardo. But thank you for that question. And Courtney, we'll go back to you.
Well, thank you, Senator Luján. Again, if you would like to ask a question this evening, press *3. Again, press *3 to ask Senator Luján a question. We've got well over 12,000 constituents joining us. Donna, Thomas, Alicia, we're getting to as quickly as we can. But right now, our next question comes from Nicole in Albuquerque. Good evening, Nicole.
Hello, and thank you so much. Thank you, Senator. My question, so it was officially announced that SNAP benefits may not be issued in November because of the government shutdown. Can you clarify whether this delay is strictly due to a lack of funding, or if there are other factors within the administration affecting the release of benefits.
Well, Nicole, this is an important question, and there's a few parts to this. First off, you may have read about and seen on the news something called a big, beautiful bill. This was a piece of legislation led by my Republican colleagues in the Senate and in the House, and it was something that was supported and advocated for by President Donald Trump. Now, in that piece of legislation, what my Republican colleagues chose to do was, or one of the things they chose to do was to go after the supplemental nutrition assistance benefits. It's actually the largest reduction in federal money ever in the history since the program was created to cut these food programs all across the country. In addition to that, you may have seen, oh goodness, back in like February or March of this last year in 2025, there was also an effort under the Trump administration to cut some of the funding that provided support to some of the local food pantries, where local farmers and ranchers would enter into a contract to grow food and raise food and sell that food to these local food depots and things of that nature. Well, that was eliminated too. So I would argue that that was the start of making it harder for more food to be available to people back in New Mexico and across the country for that matter. The second step was that big, beautiful bill with going after the supplemental nutrition and assistance food programs. And now to the point of your question on the announcement that just came from the state of New Mexico on SNAP benefits, because of the shutdown, what the state of New Mexico shared with SNAP beneficiaries is that there could be a delay. And I would argue, because today is the 21st, I would say more of that it's most likely that there will be a delay because of the impact of these programs because of the shutdown, to delay supplemental nutrition assistance benefits to SNAP beneficiaries in New Mexico. But here's the thing. Recently, the Trump administration, because a lot of us, including myself, pushed the Trump administration, and this was Democrats and Republicans, the Trump administration has access to a fund that they were able to provide support and benefits till the end of October for the WIC program. That's for women, infant, and children, as you're aware. And they were able to tap into this fund, even with the government shutdown, to make sure that those WIC benefits would survive through October. Well, I and a few of my colleagues recently wrote a letter to the Secretary of the Ag Department, the United States Department of Agriculture, and to the President himself, reminding him of the work that was done to tap into this fund that Congress created once upon a time to be able to provide more support for WIC into the month of November. And I would argue for the Supplemental Nutrition and Assistance Program as well. And so there's a program that exists in the executive government, in the executive branch, that arguably could be used not just for WIC, but also for SNAP benefits. And now that letter was sent at the beginning of this week. And so I'm hopeful, today's only Tuesday, I guess. So it was sent yesterday, I believe. I'm hopeful that we'll get a response and an answer from the administration soon. Now, with that being said, my door is open to sit down and work with Republican colleagues to get the government open. As a matter of fact, today, the Senate, we're in Washington, D.C. That's where I'm speaking with you from today. We had votes on the floor, several votes. I had 2 committee hearings today. We marked up pieces of legislation where Democrats and Republicans and independents are in Washington, D.C. From the United States Senate doing some work to get this done. There's nothing stopping us from all getting together and getting this done too. And that's my commitment, is we're going to keep working to get this done. And I'm hopeful and I'm prayerful, and I ask for your prayers as well, that this all gets done soon. And as former Governor Bruce King would always remind us, may he rest in peace, is when people can't figure things out, you put them in a barn and you don't let them out till they figure things out. And people need to start talking. Doors need to get opened up so we can get this done. But very much appreciate that question. I hope that provides some clarity. And I'll make sure the team follows up on social media to provide the clarity, maybe the letter that we sent to the Trump administration as well, so that you have specificity with the work that I've been doing in this particular space. Carney?
Well, thank you, Senator Luján. Again, if you'd like to ask a question this evening, press star 3. Again, press star 3. We've got over 17,000 constituents joining us, Senator Luján. So right now we've got Donna on the line with a question. Good evening, Donna.
Hello. Thank you for taking my call. Have a good evening. My question, Senator, is Republicans seem to be really good at defining what Democrats want and what Democrats are saying. Republicans are out there saying that we have shut down the government, the Democrats have shut down the government in order to provide food assistance and health care to illegal immigrants. How can Democrats get out and change the narrative and make it clear what this fight is really about instead of letting Republicans define us?
Well, Donna, I very much appreciate that question because it's a place for clarification. The response when President Trump says that getting insurance is about getting insurance to folks that are undocumented, or my Republican colleagues saying that with federal dollars, it's a lie. Plain and simple, full stop. It's not true. And don't take my word for it. This has been rebuffed on conservative news outlets. If you look we can post these up and get these out there as well. It's an absolute lie, plain and simple. It is illegal for federal taxpayer dollars in the Affordable Care Act, in federal Medicaid, in federal Medicare, in the federal Children's Health Insurance Program, in federal Supplemental Nutrition Assistance Program dollars to be used for anyone that is not legal in the United States, that does not, it's a lie, Donna, plain and simple. So that's fact number one. Fact number two is my Republican colleagues are in charge of the House. They have the majority. The Speaker of the House is a Republican. In the U.S. Senate, Republicans are in the majority. The leader of the U.S. Senate is a Republican. Donald Trump, President of the United States, he's a Republican. And again, as I shared in my opening, President Donald Trump, when he gave an interview a few years back, and he was asked about government shutdowns, he said two things. He said, number one, that it's a president's responsibility to bring people together to prevent a government shutdown. In the same interview, he also said, if there is a government shutdown, it's a bad mark on the president. Now, next week, the president's supposed to leave the country, if I'm not mistaken. He's going somewhere on Saturday. He's going to leave America for like a week or something. I don't think he should be leaving now. He needs to get people together. And as I said earlier, it's also been already a month, if you can believe this, 30 days that Speaker Johnson told House Republicans, go home and you're not coming back to Washington, D.C. As a matter of fact, Donna, yesterday you may have seen that the Republican leader of the United States Senate, Senator Thune said he thinks it's time that House Republicans come back to Washington, D.C. to start working on this stuff. So those are all facts. Those cannot be refuted, just plain and simple. So I appreciate the question, and I thank you for a chance to provide that clarification as well.
Thank you, Senator Luján. Again, if you'd like to ask a question to Senator Luján this evening, press star 3. Again, press star 3 to ask a question. Alicia, Annette, Rita, Eddie, we're going to get to you momentarily, but right now, Senator, we've got Thomas in Albuquerque on the line. Good evening, Thomas. You're live with Senator Luján.
Hello, Senator Luján. Thanks for your devotion to our state. The questions that I have that are most pressing, my wife and I are retired now, so we've seen all the things, all the administrations that have come and gone, and it seems that everyone focuses on job creation. Let's get more W-2 taxpayers out there, but when are we going to, or is there anything in your purview that would make corporations hold up their end of the bargain? They're making money hand over fist. The stock market seems to be endlessly rising. We have CEOs that make fortunes that small countries don't even have budgets for. The basic idea is that all this burden keeps being put on the simple, everyday W-2 worker when these corporations are getting tax credits for just scratching their heads, and they call that research, and they get a tax credit. Is there anything out there that's ever going to point the finger and make them accountable for their part and their contribution to the tax basis so that the a common taxpayer isn't the only guy that's out there footing the bill for the United States and having stuff ripped out of their hands when they finally get something they can hang on to.
Man, I mean, Thomas, you summed it up, sir. So if you know, I'm 53 right now, Thomas, and I remember a time when I was really young, that when the middle class earners were not so far away from making, you know, money the same way that maybe a CEO was making back then. The division was not like it is today, where it's thousands and thousands more that a CEO makes compared to a frontline worker, and arguably it's millions more. We're seeing the wealthier get wealthier in America. So if you're making millions of bucks a year or billions of dollars a year, the tax system is rigged for you, and I would argue it's rigged against hardworking middle-class families. As a matter of fact, during the most recent debate around tax policy, rather than prioritizing the American people, whether you know a retiree or someone that's working, where that income is, I mean, heck, in New Mexico, 250 grand is a lot of money. I would say for a really good salary. Well, most people in New Mexico don't make $250,000 a year, as we know. Now, let's start even there. Why not say that if you're making that kind of money, that if you make less than 250 grand, that's where the tax credit priorities are going to be. And even the previous president, I think he said 400,000. So just for the arguments, for the sake of this argument, let's even use $400,000 as a number. People making 400 grand a year, you probably, you know, you're doing okay. If you're making millions of dollars a year, you're doing really well. If you're making billions of dollars a year, I mean, heck, you know, you've hit it out of the park. I wish you well. I hope you make more money, but you don't need a tax break, man. The tax breaks need to go to people that are trying to get into their houses, raising their kids, trying to make ends meet, figuring out how things are with as expensive as stuff is getting these days. So why is it that the tax policy, the brunt of the tax policy that was in that big, beautiful bill, rewarded the most wealthy people in the country? I mean, I don't even know if we have any of them in New Mexico that would benefit from the top end of the point, what do they call them, the 0.01% earners in America. That's where I believe there needs to be a dramatic shift. And look, when it comes to retirees and even for Medicare beneficiaries, we need to look at the Medicare program, one, to make sure it's solvent, but also to look at savings. And what I mean by this is we can look to find savings in Medicare, but to reinvest them back in Medicare. Under the original ideas around Medicare, understanding that in the United States of America during these tough economic times that our country once faced, they created two programs, right? Social Security, and then later they created Medicare, this insurance program. But the way that I understand health, Thomas, it's not just your body without including your ears and your teeth, your mouth, and your eyes. Vision care is health care. Hearing care is health care. Dental care is health care. Why was that taken out of Medicare? Look, there's ways to strengthen programs so that we treat people with respect and dignity in the United States of America, that these wealthy corporations pay their fair share. And by the way, when these wealthy corporations pay their fair share, then you can actually have real tax breaks to small businesses as well, people that are just getting started with that small business and with that dream. Those small businesses across New Mexico and across America, that's where that tax credit should be going. And then, by the way, even on Social Security, there's a cap right now that says if you're making, I don't know, what is it, over 150 grand a year, you don't have to pay in your fair share. So millionaires and billionaires, they get off scot-free from having to contribute to some of the programs that we created in the United States of America, so that way we would not face financial uncertainty ever again as well, Thomas. So I appreciate your advocacy, sir. Those are some of the policies that I have supported, those policies that I have voted for. There's also policies like that big, beautiful bill that I voted against that rewarded the most wealthy in the country while it devastated food programs and healthcare programs across New Mexico and across the country. So again, appreciate a chance to provide clarification on some of the work that I've been doing, and very much agree with the premise of that question about where there should be attention to providing tax relief to the American people. And there's a difference between giving it to the most wealthy in America versus people that are in the middle class, striving to get into the middle class, small business owners. That's where this support should be going. Courtney?
Thank you, Senator Luján. Again, if you'd like to ask a question this evening, press *3. Again, press *3 to ask a question. Jennifer, Don, we see you, and we're trying to get to you also as quickly as possible. But we've got Alicia on the line right now, Senator, with a shutdown question. Good evening, Alicia. You're live with Senator Luján.
Hi, thank you, Senator, for taking the time to answer everyone's questions. My question to you is, what is the actual plan of Democrats to end the government shutdown if Republicans aren't willing to come to the table and negotiate? You said yourself that they have total control of the House, of the Senate, the presidency. There is no incentive for them to come to the table and negotiate. So it seems like everything I've seen is just Democrats sitting and waiting on the Republicans, and I want to know if there's an actual plan to get them to come to the table.
Well, Alicia, I appreciate that question as well. And look, every day that I'm here in the Senate, you know, if you have access to C-SPAN, you throw that channel on when we're voting, you'll see me on the floor talking with Democrats and Republicans. There needs to be conversations, whether we're in elevators, whether we're in a meeting, we're in a room, we're on the Senate floor, we're in a committee room, wherever we are, those conversations need to take place. And I'll tell you, they are taking place. I've been sharing concerns about what's happening with healthcare, and even reminding my colleagues about what happened to me when I had my stroke, what it means to me personally, what it means to constituents. And I also remind my Republican colleagues that this isn't a fix for just Democrats, if you will, or for people that live in states that are considered blue states, or, you know, this is about the American people. Every state in the United States of America has constituents that are going to hurt in their health insurance premiums doubling or tripling, millions of people that will lose coverage altogether, and millions that won't be able to afford it, that will cause that shutdown and that loss of access to insurance as well. And so in my conversations with my Republican colleagues, Alicia, while most of my Republican colleagues are not speaking out publicly, I can tell you privately, most of the Republicans I've spoken to, they understand that something has to get done to make sure that insurance premiums are not going to double for their constituents. And then for my Republican colleagues in the Senate and in the House that are saying out loud what others are saying privately, I mean, Marjorie Taylor Greene, who's one of the most conservative members of the United States House of Representatives, she said already, it's been already like 2 weeks, I think, that she has said this now, that she knows that for her kids, that their health insurance premiums are going to double. And she has been telling Speaker Johnson to bring the Republicans back to the negotiating table and getting to the table to get this thing done. Bring them back to the House. We have another colleague, Congresswoman Malliotakis. She's out of New York. She said something similar over this last week. There's a colleague out of California that has been even coming to Washington, D.C. on his own saying, bring us back, bring the Republicans back. We need to get to the table to negotiate this. I mean, even President Trump last week said that he wants to do something on health care, and then he's walked away from that, but he said it out loud. And so I'm certainly hopeful that as my Republican colleagues are talking to more of their constituents, which I think they are, that's also moving them as well. And so we have to keep pushing here. Again, I'm open to talking to my colleagues. If they want to talk about reforms, I'm open to talking about reforms. Again, they're in charge. They're in the majority. And so let's do this. And again, Alicia, I'll just remind you something that I said earlier, which was under the previous administration, who was a Democrat with President Biden, when Democrats were in the majority of the Senate and in the House, there wasn't a shutdown. And it's not because we didn't need Republican votes. It's because we would sit down at the negotiating table and we would come up with a way to ensure that we could get this done. And that's what needs to happen right now. And at least for those of us that are in the United States Senate, Alicia, we're here. I'm in Washington, D.C. now. I was on the floor voting on the U.S. Senate floor. I was in committees working on bills today. I actually got a bunch of amendments to provide some more relief based on those awful fires that we had back in New Mexico that I was able to get into a piece of legislation today. And then we had another one on pipeline safety where I was able to get some amendments in there as well, in that one of those packages as well. So I know that colleagues are here, they're working, they're front and center, and we've got to keep pushing there. So keep pushing and holding us all accountable, Alicia. That's critically important as well. Being vocal, being active, and holding us all accountable. But thank you so much for that question. Really appreciate that. Courtney?
All right, Senator, right now we've got Annette in Albuquerque on the line. Good evening, Annette.
Hello. I just want to say I am a part of the government shutdown, and my question was basically what Alicia's was. But my bigger concerns is, what am I supposed to do right now? I'm extremely stressed. I'm not going to be able to pay, for example, my rent. I called United Way today because I needed to try to get some resources. And one of the things is, you can get a loan, but at the same time, how am I going to get a loan and not be able to pay it back? My other problem is the fact that, I do have diabetes and I'm not going to be able to pay for my medical supplies. So I know you guys are working hard to try and get the Republicans in, but what are government employees supposed to do right now to actually live?
Are you by any chance, are you a federal employee or are you a contractor? Can you share that with me? An employee.
I am a federal employee.
Okay, so one thing to be clear, well, let me just start off this because I didn't say this clearly enough to Alicia, and let me say this to you as well, is I absolutely want to see an end to the shutdown. So let me be clear about that as well as we're working together here to get that done. Now, for federal employees that have already been impacted by the shutdown, when President Donald Trump says that federal employees are not going to get back pay, that's a lie. It's illegal. As a matter of fact, Democrats and Republican colleagues have been clear about this position because we all worked together to make sure those protections were put in place years ago as well. And so if we can work with you to make sure we get clarification there, that's something I'd be happy to work with you with my office as well, number one. Number two, because federal back pay is required by law, and again, it's a law that President Trump himself signed into law. I think it was back in 2019, and this was a law that was bipartisan. It was Democrats and Republicans that worked to do this. Because there's back pay, that's where I would point on working with any of the local financial institutions, and I think it's, I'm not trying to pick winners and losers or direct you to which financial institution, but I believe that it's credit unions right now that are working with federal employees that have been impacted to help provide support to them as well. And if you just show that paycheck, that's all I think that's needed with some of this as well for that kind of support. And so the other thing is I'd encourage you to reach out to my office so that way we can provide support as well. And the number to my Albuquerque office is 505-337-7023, 505-337-7023. And then for everyone on the line, the number to my Washington, D.C. office is also 202-224-6621, 202-224-6621. Now, the last thing that I'll share with you as well is just something that I encourage everyone anytime that stress is in our lives, and it's not just because of the government shutdown, it's all of the challenges we all have. And especially after I survived my stroke, this is something that matters to me very much, is understanding the stress and uncertainty, how this takes a toll on just our mental health as well. And so that's another area where there are services and available to people. We have access to those numbers, one of them, just being 988 as one of those simple areas as well. But just be aware of that and reach out, whether it's to my office specifically, so that way we can go through that as well. But if you are a federal employee, again, back pay is required based on the law, a law that President Trump himself signed into law back in 2019 as well. Thanks for that question. Courtney?
Thank you, Senator. Eddie, Jennifer, we're going to get to you in just a few moments, but Senator Luján, we've got Rita in Albuquerque on the line right now. Good evening, Rita.
Good evening, Senator. I just wanted to voice my support for you standing your ground and protecting our health care, amongst other things. I appreciate your questioning of these cabinet members and directors. This is exactly what we need to do, and they need some oversight, and you are doing your job for your constituents, and I appreciate that. And now is not the time to let up. And just one more thing, I am from northern New Mexico as well, so you're doing us proud. Thank you.
Rita, thank you for that. Gracias, if I may. Rita, look, as I shared earlier when Thomas asked that question, when it comes to New Mexico, I'm willing to work with anyone from any political spectrum that I work with here in D.C. to make things better for people back home and across the country. But if I see policy or I see someone up to something that's going to hurt families back in New Mexico or hurt our state, I can't put up with that. I have to stand up and stop it. That's how I was raised. Whether it was there in Nambe, with the fields or with the acequias or cleaning the barns or whatever it was, or working with families, as I have the honor to do now, representing people in New Mexico. And Rita, my late father, and may he rest in peace, my dad always reminded me that behind every vote is a person. And you need to remember that whenever you're in a room, whenever you're in a committee, whatever it is, there's people back home that get impacted by those things, by those votes. And that's how I work to get things done. I represent everyone in New Mexico, Democrats, Republicans, Independents, left, right, in the middle. It doesn't matter. I have the honor of representing everyone in New Mexico. And one thing that I'm proud of, Rita, is that I've had the honor of traveling to most corners of New Mexico. Whether it's a community that's a little more conservative or one that's a little more progressive. We're all New Mexicans back home, and we all need support. We all need to make sure that we're working with each other, that we learn from each other. Now, some of us have a different way of achieving some of these goals, right? Well, we should have that conversation. But when it comes to home, Rita, we should all be willing to roll up our sleeves and put the work in to make home better. So I appreciate your kind words. And, when it comes to fighting for home, I have that distinct honor. It's who I am. I wear it like a badge of honor. I love being New Mexican. I celebrate it every day here. I brag about it. And anything I can do to help make a difference at home, I'm there. And look, if there's a difference of opinion, I'm also willing to listen. I'm also willing to listen to see how we can do things better and make things better for everyone back home. So, Rita, thank you so very much. Courtney?
Well, Senator Luján, we've got Eddie in Albuquerque on the line right now. Eddie, you're live with Senator Luján.
Hello, Senator. I'd like to also thank you for hosting this and putting yourself up front to answering all these questions. But I have a question, and then I have a suggestion. So my question is, are the Democrats committed to standing their ground and not folding to opening the government without funding or continuing the subsidies for health care and making it, continuing to make it affordable? That's my question. How committed are they? And I hope that they are. I'm actually a federal government employee, and I'm at the risk of getting furloughed here maybe soon, but I don't want the Democrats to give up the fight. And the suggestion that I have is, I think there should be a bill that's introduced to get the senators, the rest of the senators, to not get paid during a shutdown as well. I mean, because I think if they don't get paid either, I think solve the problem pretty quick if they aren't getting paid. But Democrats introducing such a bill I think would be favorable in the eyes of the American people to say, we're willing to suffer with you if this is going to happen again. But even putting that out there today, tomorrow, or mentioning it, I think would go a long way as far as optics go in the eyes of the American people, because people are suffering and they're going to suffer. And if somebody's willing to say, we'll suffer with you, we're going to not get paid, let's say a week or 10 days after a shutdown happens, because you guys got to go in, do your job, get paid, that's fine. But at some point, I think the Congress should not get paid either. So that's a suggestion of mine.
Appreciate that, Eddie. So on the first side, looking at where people are standing right now, look, I really think that my Republican colleagues, in addition to my Democratic colleagues, understand that constituents in all of our states are about to get hit with a tax to pay for health care. And what I mean by that is it's a taking of money. If these tax credits go away for people in New Mexico, it means about $7,000 a year. That's real money that is going to be added to the cost of people all across the country. And for millions, it'll just make healthcare unaffordable. People are going to go without. They're not going to be able to afford getting health insurance because the premiums are going to be so expensive. And so I know that my colleagues are standing strong here, and I would argue that many of my Republican colleagues, while they're not saying it publicly in the Senate yet, they also want to help their constituents. They don't want to see their constituents lose access to coverage. And for many people, as you know, Eddie, this is a matter of life and death, man. If you can't go to the doctor or you can't get checked and something bad happens, you have a health scare, it's just not right. So I'm prayerful and I'm hopeful that people will continue to stand strong in this space. And to your other question, one of our colleagues, I think out of Florida, has actually recently introduced a bill along those lines. And so I'll raise this to colleagues as well and just appreciate that as well. But I want to say that he introduced it maybe a week or two ago, if I'm not mistaken. And I'll see if I can find some information on that, and I'll do my due diligence to get that thing posted. But yeah, I appreciate that very much, Eddie. Thank you so very much as well, sir. Carney?
Senator, we've got Jennifer in Albuquerque on the line right now. Good evening, Jennifer.
Hi, good evening. So,
good evening,
thank you.
Jennifer.
And you can hear me, right?
I certainly can, yeah.
Okay. So my question is, it's just one question, but I'm going to frame it a few ways. Where can we find out or how New Mexico plans to mitigate a disaster? What can we do to mitigate the consequences of these cuts? Like, we already deal with a lot of homelessness and medical bankruptcy. Our hospitals are rural, and we've already stated they're at risk or will shut down, which will overcrowd Albuquerque and probably Las Cruces. And are we joining with other organizations to provide resources, like for the community members, like our laid off federal workers, say fighting for home? So that's kind of like, what can New Mexico do besides support you and, our votes and rallies and such? What can we do on the ground, hands-on? Are we working with organizations or something?
Well, Jennifer, thank you very much for that question. What I will ask my team to do is on our website and then on the social media feed is put a link to some of the work that was actually done in New Mexico recently. And so you may have seen that there was a special session, something that Governor Michelle Luján Grisham worked with the state members of the state Senate and the state House of Representatives, and they came together anticipating that there might be some potential shutdown, but especially to respond to that big, beautiful bill that I responded to, where the Medicaid federal funding was devastated, the supplemental nutrition assistance programs were devastated, housing programs were devastated, education programs were devastated in that particular piece of legislation. And so when they came together at that time, they came together to say, okay, for the states, the rest of the fiscal year, which is how the state of New Mexico operates, so that takes us through June of 2026, okay? So until July 1st, to what is that, June 30th of 2026. What they put in place was they said that they're going to provide some additional support to different programs in New Mexico to anticipate that the big beautiful bill or any government shutdown impacts would help. Now, that does not prevent closure, like but potentially to think of what like Los Alamos National Labs or Sandia National Labs or other federal partners in New Mexico have recently announced in those particular spaces. But with some of the food programs, the state of New Mexico had some funding in that particular area. With Medicaid funding, they had some funding in that particular area. Even with some of the tax credits, they proposed putting some funding in that would provide support through that runs through June. And then there's a question as to what happened since then as well. In addition to that, there have been many conversations with different organizations throughout New Mexico, with the governor's office specifically, with the federal delegation, that's myself, Senator Heinrich, Senator Teresa Ledger Fernandez, Melanie Stansberry, and Gabe Vasquez. Also having those conversations with groups, organizations, nonprofits, other entities, philanthropy organizations, to maximize what can be done. But I'll argue, Jennifer, that's a Band-Aid. This needs to happen. There needs to be an effort to make sure that there's real policy to prevent insurance premiums from doubling, and that the government gets opened up. That needs to happen. There's conversations right now about funding bills and appropriation bills. I mean, all the inside baseball and all the legislative stuff that is all going on right now. There are appropriation bills, which are the funding bills to fund the federal government, that have already passed the United States Senate, that are sitting in the U.S. House of Representatives, that Speaker Johnson hasn't even taken up. We're talking about sending even more now over there, and that's another way to fund the federal government. I mean, quite honestly, when the appropriation process works, that's when this gets done. And so again, I'm hopeful and I'm prayerful. I know we had another question earlier about the plan. I think it was Ashley from Española that asked that question. So that's part of this as well, is getting to the table, negotiating, getting these funding packages adopted as well. But it still takes negotiation. And so more conversations need to take place, working with, recently in New Mexico, for example, to the question that was asked earlier, like even the utilities, I think, announced recently that they will work with impacted employees during the shutdown as well. So just get in touch with them in that particular area. But there's a lot of conversations going on in this particular space. But none of that will address the fact that there's still not movement to get this done. The government shutdown needs to end. These tax credits need to get adopted so that health insurance premiums don't double for people across the country, and that health insurance premiums get more expensive for everyone. That has to happen. So very much appreciate that question and bringing it all together. Carney?
Well, Senator Luján, we've had almost 18,000 constituents on the line. So before I turn it back over to you for a brief closing, I want to remind everyone on the line, if we weren't able to get to your question or comment, and especially if you need casework help, please stay on the phone. And at the end of the call, you can leave a voicemail. Please give us your name, email address, and your message. Also, please follow us on social and ask us. This telephone channel brought up a lot of questions. So, and any more questions you have, follow us on social and ask us more questions at Senator Luján. Again, at Senator Luján on social media. And now, Senator Ben-Ray Luján, I'll turn it back over to you.
Carney, thank you. And again, if you need help with casework, please stay on the line, and we have staff that will be on the phone here to get your information so we can follow up with you. You can always go to my website if you have access to the internet. That's Luján, Lujan, .senate.gov, Luján.senate.gov, and there's place there that you can also let us know that you want to get in touch. My Albuquerque office, again, 505-337-7023, 505-337-7023. The Washington, D.C. office, 224-6621, 202-224-6621. To everyone that joined the call tonight, thank you so much. I'm sorry that I can't be there in person with you, but I wanted to make sure that we were making ourselves available to answer questions that we were getting and just keeping everyone informed across New Mexico. It's why we'll also put this on our social media accounts as well, so that way you can go back and take a look there as well. Look, everyone, if things are getting hard, please reach out to me in the office. There's resources across the state. Make time for yourselves. Check in on families and loved ones right now as well, because people, as you all know, back home, one thing I'm proud of with New Mexicans is we look out for each other. So just, please visit with friends and look, be open to have conversations with folks where maybe there's disagreements as well. Let's lean in and support each other right now. And as I said several times tonight, I know that this shutdown's created real hardship for families. I want to see this shutdown end. I also want to make sure that health insurance premiums are not going to double for all of you. That's something that we need to figure out here in Washington, D.C. for the good of people across New Mexico and the good of people across America. So thank you all so much. Please be safe. Thank you for being a part of tonight's town hall as well. And look forward to seeing you somewhere on the road, whether it's, maybe grabbing a burger, maybe grabbing a burrito at Allsups, or, hitting a lot of burger or something, everybody. But you all be safe, and I look forward to seeing you all here real soon. Thanks again, everyone. Thanks for being on the call. Courtney, I'll turn it back over to you. You give instructions on the end of the call. But thanks again, everyone. Thanks for being on the phone tonight.
Again, if we weren't able to get to you, please leave a voicemail. Please leave a voicemail. And this concludes this evening's telephone town hall.